This presentation will provide a brief and concise information about acute angle closure glaucoma. In general, glaucoma occurs as a result of increased intraocular pressure caused by a malformation or malfunction of the eye drainage system. Normal intraocular pressure is 8 to 21 millimeters mercury. The increased pressure causes compression of the retina and the optic nerve and causes progressive, permanent loss of eyesight if left untreated. The term angle closure refers to a collision of the trabecular meshwork by the peripheral iris obstructing aqueous outflow resulting to increased intraocular pressure. Angle closure can be primary when it occurs in an anatomically predisposed eye or secondary to another ocular condition. In acute angle closure, the process occurs suddenly with a dramatic onset of symptoms. The sudden and severe intraocular pressure elevation can quickly damage the optic nerve, resulting in acute angle closure glaucoma. Acute angle closure is a true ophthalmic emergency, and a delay in treatment can result to blindness. In acute angle closure, the patient usually comes in due to sudden onset of painful red eye. Patient may also present with the following dramatic symptoms: blurring of vision, headache, and nausea and vomiting. Patients may complain of seeing halos around lights, which may result from corneal edema. The attack may have been precipitated by pupillary dilation, which may result from activities such as going to a movie theater, taking over-the-counter medications that contain antihistamine for cold or allergy, or using dilating eye drops as part of an ophthalmic examination. Patients with acute angle closure may be extremely uncomfortable and distressed. In diagnosing acute angle closure glaucoma, a complete ophthalmic examination should be conducted in patients who present with suspected acute angle closure. This include gonioscopic visualization of an occluded anterior chamber angle in the affected eye. Tonometry demonstrates an elevated intraocular pressure, which may be as high as 40 to 80 millimeters mercury. Slit lamp examination may reveal conjunctival injection, a fixed or sluggish and mid-dilated pupil, a shallow anterior chamber, corneal epithelial edema and bullae, and cells and flare. The patient may be sensitive to light and the eye may be tearing and closed. Ophthalmoscopy may reveal a swollen optic disc in an acute attack or excavation if episodes have been chronic or repetitive. Ultrasound biomicroscopy. This imaging technique can be used to visualize the angle and surrounding structures. They can provide objective and quantitative measurements to document changes to the angle before and after treatment. However, clinical assessment and the use of gonioscopy may be more practical and applicable if a patient has acute angle closure. The treatment of acute angle closure glaucoma consists of intraocular pressure reduction, suppression of inflammation, and the reversal of angle closure. Drugs that can be prescribed to lower intraocular pressure include 1. Acetazolamide, brand name Cetamide, 500 mg as initial dose, then 250 mg 3 times a day. Acetazolamide reduces rate of aqueous humor formation by direct inhibition of enzyme carbonic anhydrase on secretory ciliary epithelium, causing in turn a reduction in intraocular pressure. A dose of a topical beta blocker, example carteolol or timolol, will also aid lowering intraocular pressure. And mannitol, 1 to 2 mg per kilogram body weight IV bolus. Hyperosmotic agents reduce vitreous volume, which in turn decreases intraocular pressure. To suppress inflammation and reduce optic nerve damage, topical steroids, 1% prednisolone acetate, is usually given. Approximately 1 hour after beginning treatment, pilocarpine, a miotic that leads to opening the angle, should be administered every 15 minutes for 2 doses. In the initial attack, the elevated pressure in the anterior chamber causes a pressure-induced ischemic paralysis of the iris. At this time, pilocarpine would be ineffective. It is better to admit the patient. Once intraocular pressure is lowered, glaucoma filtering surgery is done. Thank you for watching.